Hello, I'm Dr. Nasaba Noor. I'm one of the founder and mentor of PACES Care. Today, I would like to share a few words of the Station 4, that is the Communication Skills Station. Though the total number of the station is only 16, but it contains the two important domains, that is the clinical communication skill and patient concern. So my advice to the candidates that they have to be very well structured and very well performed in the station so that it will be like a piece of cake in the examination hall. So first, I would like to say about the time distribution of the station 4. In currently, it is a 20-minute station, 4 minutes to talk to the surrogates, 1 minute for reflection, and at the end, 5 minutes to do the crossing with the examiner. In the new format, which will be launched soon, it will be the station will be just 10 minutes. There won't be any crossing, though we have to at that time we have to do two station 4 in the examination. So, and before entering the exam hall, you will get 5 minutes to read the scenario very well. So now come to the tips of the station 4. So the 5 minutes that I was talking about that you will get before entering the examination hall is very, very important. In this time, we have to read the scenario. My advice is to read the scenario at least 3 times. If you read the scenario very well, like a story, then you will get the concept of the scenario, and you have to write down the important tips or important scenario or important points from the scenario in a paper. So in the examination day, you will be provided some white papers and pen that you can write down before entering the exam hall. I mean the exam room. So my cheat sheet regarding the those 5 minutes preparation that you will do before entering the exam room. So when you get the white paper, so you have to draw a line over here and divided it this, and you can divided the page into some multiple boxes. So what will write down in this paper? So first box, you will write down the name and age of the patients. Sometimes we have to talk to the relatives, then you have to write down the name of the relatives and the relationship with the patient. Then your role. Every scenario on the beginning, you will see that it's written either you are the senior house officer in the neurology ward or the specialty register in the hematology ward. Your role has been written, so you have to write down your role. Then other boxes, you have to write down your task. It is very important because sometimes they want us to take a consent for a procedure, sometimes they want us to do counseling for a chronic disease. So these things you have to write down your task over here. So now come the main parts of the station 4. I'm coming it in a few minutes. And then the other box, you have to write down the additional question to ask or additional point. Like suppose for example, the scenario comes with a seizure patient, and we all know that if a patient comes with seizure, we have to advise him regarding some lifestyle modification. We have to advise him to cease driving for a while and inform the DVLA about the fits. So these things are usually or not always written in the scenario. These things are kept hidden. So after reading the scenario, you have to get the vibes of these hidden tips, and we have to write down in the here. And the last box, you have to write down the ethical and legal issues that can be asked in the crossing that are related to the senior, like for like consent, mental capacity act, human tissue authority. These things you can write down in this here, which will be helpful in your crossing. Now comes to the main parts of the station 4. So I usually divide this part into 4 categories, like the station 4. First, the introduction, body part, social history, lastly summarize. First, the introduction. So in current format, I would advise you to spend 1.5 minutes in the introduction. You have to share a few words to build a rapport with your patient. For example, hello, I'm Dr. Noor. I'm the doctor in the medical ward today. Today I'm here to discuss about a health condition. Is that all right? So are you Mr. Robert, 65 years old? Nice to meet you, sir. And in our conversation, I'll make some notes which will remain highly confidential. So are you comfortable here, sir? So what's bringing you here today? So in this way, we can introduce the conversation and build a rapport with our patient. Now let's come to the second part, that is the body part. In this, regarding this point, I will advise you to practice the session 4 in a structured manner. Like if you go through the cases that commonly appear in the station 4 in PACES exam, you will see that either it's a breaking bad news or counseling for a procedure or palliative care management issues. These things are coming to play. So if you or sometimes dealing with a medical error, dealing with a non-compliant patient, so if you make format of each and every cases, then it will be very helpful in your exam day. So after the discussion, the third part comes into part, that is the social history. Though we don't take history a lot in station 4 like we do usually in our history station, but here we have to take some portion of the history. Like if it's related to our scenario, then we have to ask about the alcohol and smoking habits of the patient. Then we have to explore very carefully and meticulously about his job and personal life, and how is the condition currently affecting his job and personal life. This is very important and crucial for station 4. They want us to explore these things in a very meticulous way so that we can provide some support to them, like from occupational health department or social service support. These things can be done. So here I have write down this part: the social history, alcohol, smoking, job, personal life, and any supports. And after that, all these things we have to ask for any additional concerns, and we have to answer them very appropriately. My advice is to start to go to the concern even before warning that's 2 minutes left. So last portion of the station 4, that is summarize. So we at this portion we have to check the understanding, and we have to provide some supportive material like brochures, leaflet, links, any society, any specialty nurse we have to give them. So the check understanding and supportive material and society. So this is the way we can complete our station 4. My other advice to our students that you have to practice this station on everyday basis. It if you do that on everyday basis, we will perform in a very professional way in the examination hall, which will be very helpful to you. And my other tips is to that students should be very well oriented of all the ethical and legal issues that commonly appear in the PACES exam, because these are commonly discussed or questioned in the crossing part. So that's all for today. If you find the video helpful, please like the video and subscribe to our channel. You can also follow our Facebook page, that is PACES Care. Thank you. And if you have any comments, suggestion or advice, please don't hesitate to ask. Thank you very much.